So, hello everybody. My name is Claire Mearns. I'm a consultant anaesthetist and intensivist at East Surrey Hospital in Surrey, and I'm also the chair of the final FRCA exam for anaesthetists and have been an examiner at the Royal College for 11 years now. So I've been asked to talk to you about tips for taking the oral FFICM SOE / OSCE exam. So I thought what I would impart today is some of the knowledge that I've gained over the years, just to help you on your way with taking your upcoming exam. So just to put it in a bit of context, so you've obviously already sat the written exam. And the background with the written exam is that an MCQ or SBA is about a veneer of knowledge that goes over a very wide breadth of subjects, but is slightly skin deep, so it doesn't test depth of knowledge. An SOE oral exam is about pushing that a bit harder to see how your depth of knowledge is and whether you actually understand the subject in depth. It's all very well knowing what the words mean sometimes, but sometimes when you push people, they actually don't really have any depth to understand why they're saying the words they're saying. So that's kind of what the SOE exam is about. So what I'm going to do today is I'm going to talk about how to prepare. I'm going to talk about the setup of the exam, what we're looking for as examiners, and just to try and allay your fears a little bit. So how to prepare. Obviously, you do need to do some reading. You will have already done some reading behind, otherwise you wouldn't have passed your written exam. So you do need to do a little bit of book work. However, you have got to practice talking and practice vivas with other people. You cannot just get through this looking at books and looking at old papers. You have got to practice formatting questions and getting your ideas out into the open. There's quite a lot of information out there. There's a lot of old questions. Obviously, there's loads of stuff in books. If you go onto the FFICM website and look up annual reports of the FFICM exam, within the annual report, they talk about pass marks, and they also will give question examples that they've had during the last year. So it's quite a useful piece of, I didn't know that was there until I actually had a look. The Royal College of Anaesthetists doesn't do that in quite such a helpful way, but the FFICM do that, and it actually is quite nice to give you examples of questions that they've asked on every day of the week that the exam went on and what all the question types were. So it just gives you an idea about things to look at. The other thing just to remember to look at is any national alerts, any new guidance that's come out. For example, there's been quite new guidance on brainstem death testing. So it's worth knowing any changes in policies, whether that's airway stuff, whether that's resus guidelines, sepsis, all that kind of stuff. But as I said before, you have got to practice talking, whether that's with your colleagues who are sitting the exam, juniors that you're with. So if you've just learned something and you actually want to try and see whether you can understand it, go and tell, one of the F1s or CT1s that you've got with you and just say, can I tell you about X, Y, and Z, and see if they can understand what you said. If somebody else can understand you explaining to them, it means you've probably got a good grasp of what's going on. Obviously, there are courses out there as well. That's all very well, but obviously that will just be a day, a week, and you've got to just keep doing this. A lot of people will shy away from talking, from doing vivas, viva practice, because they're just too embarrassed doing it amongst their colleagues, but you've just got to do that. It's also worth videoing yourself so that you know what your bad habits are. Some people fiddle a lot. They fiddle with the pen. They don't sit still. And often we don't know what our bad habits are until somebody tells us or we see ourselves in video. We all hate watching ourselves in video, but that's the good way to know what your bad habits are. Just to talk about the structure of the exam, I'm sure you know this already, but just to put it out there, you basically will have 8 oral questions to do during this exam, which are 7 minutes each. So there'll be 4 stations, so 4 sections that you'll rotate round to, with 2 examiners in each. So you'll have 2 questions in each station, so you'll see 4 different sets of examiners. There'll be a very short amount of reading time outside the station. It's not really reading because it will basically say what those questions are about. Now, this is the difference between the FRCA and FFICM. FRCA exam doesn't have this, whereas the FFICM does. To be honest, I'm not sure if it's a good or bad thing. I don't know if it's helpful to know when you're going in that you're going to be asked about malaria when you know absolutely stuff all about malaria and you're having a complete heart attack because you can't think of anything. I don't know if it's a good thing or a bad thing, but that's the difference if you have done the FRCA exam, if you're an anaesthetist as a background. Another thing, obviously, just to say is that those of you who have not come from an anaesthetic background, which is going to be more than 50% of you, will probably never have done a Viva exam in this way. You'll be used to OSCE exams or things like this, but you won't have actually done a Viva. And that's why it can be a bit of a shell shock thing if you've never done it before, which is why you need to practice. So, as I say, you'll have a vague idea before you go in what the questions will be about. As I said, I'm not sure if that's a good or bad thing. You'll sit down, the examiners will introduce themselves, and then the bell will go, and you'll do the first question for 7 minutes, and then the bell will go in the middle, and then you'll do a completely different question for another 7 minutes, and then that will end, and you'll go out, move around to the next station, quick bit of time in between, and then you'll do the same thing again. It can be really tiring. It's quite hard having to concentrate for a long time. So just, make sure that you haven't done a massive weekend on call the weekend before. You've not just come off nights, because actually it is just mentally really exhausting doing this. The marking of the exam is a slightly closed marking, so there's only 3 different marks you can get for a question. So 2 is a pass, so it doesn't mean to say you were fantastic and you got everything right, it just means you were satisfactory, actually. 1 is borderline, and a 0 is a fail for that part of a question. Each examiner will mark each question 0 out of 2, and as I said before, there are 8 questions, so there's a possibility of 16 marks from each examiner, so that's 32 marks total. There isn't a set pass mark, and this is because there used to be, but because one paper for, say, Monday is not going to have the same difficulty as the paper for Wednesday, there is some borderline regression that goes on so that the paper is marked fairly for the difficulty of the questions, and it's usually about 27. It may be slightly lower if the paper is deemed to be harder, or slightly higher if it's deemed to be easier. That's why it is not a set pass mark. So I just wanted to show you what examiners are looking for when we are marking. So as you can see, this table that we've got in front of us, it shows you the things that we're looking at for a 0, a 1 and a 2. Those candidates who are amazing and fly through with good knowledge and understanding, they're usually this is the green box, are usually very fluent. They show adequate depth of knowledge. If you push them, it means they can explain what they're talking about. If they make a mistake, they might make a mistake. So it's not about being perfect. It's about self-correcting if you've made a mistake. And they can actually work things out. They might not know everything, but actually if you give them information, they can actually work it out. So as an examiner, it feels quite easy, okay? And this will become more clear when I'll tell you what the other 2 things are like. Borderline candidates show partial or incomplete knowledge or understanding of a topic. So they might know what the words mean. No, sorry, they might say the right words, but when you say, what does that mean? They don't actually know what that means at all. So they're sort of very superficial, can't correct their own errors, and can make sort of slightly illogical clinical decisions. Now, the borderline ones can be really hard to mark, because with the 2 examiners, one of you might go, actually, that was all rightish, and one of you might go, no, it was a bit borderline, and actually you'll end up with 3 out of 4, and actually that's probably about the right mark. The fail candidates, so the ones who have very limited knowledge or understanding, it's slightly where they will throw out lots of answers in a scattergun fashion in the vague hope that something might stick. And we all know, we've all seen people answer questions like that before. It's very disorganized. There's no planning or structure to it. They don't really understand it. If you push them a bit, they can't answer it at all. Or if you do something that is very dangerous clinically, I personally don't give zeros very often because I think you have to work quite hard to get a zero, unless you do something that clinically would kill the patient, or you don't recognise something on an X-ray like a tension pneumothorax or something, which hopefully wouldn't be on an X-ray in the first place. And again, if it is really difficult for me to examine, if it feels like I'm pulling teeth out because I'm trying to drag information out of you, it is not a 2. It's going to be a 0 or a 1. So it just sort of, hopefully this table will show you sort of the things we're looking for. And in some questions, candidates may fall on the borderline, but we hope the majority are in the green, in the sort of fluent and pass. Again, that doesn't mean to say you're perfect. It just means you're satisfactory. So things that I really want you to take away from this is how to answer a question. The examiner will start with a standard opening, and I want you to answer what you are actually being asked. So some people will, and it's this classically in written papers, isn't it? People will answer what they hope they were asked or what they wish they were asked, but actually not what you are actually being asked. So answer the bloody question is all I'd say. My mum used to say this when I was doing my GCSEs. Genuinely answer the question, please. If you don't hear, please do ask them to repeat the question. It can be really noisy in the exam room because there's lots of people being asked questions at the same time. So please do get the examiner to repeat if you didn't hear. There's nothing wrong with doing that, okay? Once you've been asked the opening question, have a pause, just collect your thoughts for a second, and then answer. Some people just dive straight in, but it's absolutely fine to just have a moment and just think about how you're going to reply to the question. It is worth practicing giving an opening sentence. What often I do is, if I'm doing practice with candidates, is to almost get lots of different questions and say, what is myasthenia gravis? So literally give me a sentence, plonk. And then next question, I want you to start with something that's a very opening thing that just sets the scene on the question, on the answer that you're going to give. So don't dive straight in, just have an opening thought. Have a structure for answering the question too. So for example, if you are asked for causes of something, then think about your surgical sieve. If you're asked for drug side effects, try and go through, whether it's cardiovascular and then respiratory. So try and, instead of doing the scattergun approach, try and have something very methodical. And this will help you. So if you're thinking, I have no idea at all of anything about this answer, at least if you have a structure, then you will probably be able to think of something to say. If you're giving causes of something, please go for the most obvious one first. For example, if you're talking about pancreatitis, talk about gallstones or alcohol. Don't start with azathioprine and scorpion bites, because actually that isn't going to be terribly helpful. Even if in your mnemonic of answering that is something that comes first, please give the most obvious things first. If you have a complete brain freeze and cannot think of anything at all, you've literally, all the information has fallen out of your head. If it's a clinical scenario, try and put yourself in that clinical scenario and think, what does this patient look like? What monitors have I got here? Are they unwell? What bits of equipment do I need? What would I be doing? And that might help you just think about a sensible answer to give. And the other thing I cannot stress enough in a clinical scenario is, please tell the examiner what you would actually do, okay? Not what you think they want to hear. I see this all the time in anaesthetics exams. They're telling me how they'd anaesthetise somebody and they're giving some really random drugs. And you think, you wouldn't do that. You would give them propofol and rocuronium. Why would you give atomidate or something like that? You have to answer what you would actually do. It is so much more realistic if you do that. It will help hone your mind to actually what the patient looks like in front of you, and you're just being real and honest. And as long as you can justify why you're doing that, that's fine. We know that medicine is not an exact science. We know that there's lots of different ways to do things, but if you can justify what you're doing and why you're doing it, that's absolutely fine. So please do that. It's much more realistic. This is how you're going to feel, okay? But just if you can do the things that I've just said, it might help just calm you down a bit. Other things that you should know, and I know you're not going to believe me here, but the examiner does want to pass you, okay? I know you're all laughing at this point because you're thinking, no, that's not true. You have to fail so many people. No, that's not true. If everybody gets over the line in terms of the mark they need, everybody will pass, okay? I genuinely, when I've got somebody sitting in front of me and I can just feel that they know that's a really, really painful question they've just asked, I want you to say the stuff. I want you to pass. It doesn't help me if you fail. I don't get a scoring system where I, get marked down if somebody passes. So we want to pass you. We want you to get through this. The other thing to say, it's okay if you make a mistake. So in one of my anaesthetics exams, I think they said, oh, what's the sensory supply to the face? And I think I said, oh, it's the facial nerve. And I went, no, it's the trigeminal nerve. And actually, that's okay. That is genuinely fine, because it shows the examiners that you've recognised that you've made a mistake, you've self-corrected, and it shows understanding. So that is absolutely fine if you do that. If you say something stupid and they go, oh no, I didn't mean to say that, that's rubbish, that is okay. The thing to remember, that it is okay to have an absolute car crash on one of those 8 questions. Okay, you can literally score 0 on it. However, you cannot do that on every question, clearly, and you have got to park it and put it behind you if you have a disaster on a question. So genuinely, you can have an absolute disaster on one question, whether that's in the OSCE or whether it's in the Viva, but you have got to move on and just park that behind you. If you let it affect your performance for the rest of the exam, whether that's through the Viva or whether you take that to the OSCE with you, then that isn't helpful. So to just park it, because often you probably have done better than you think. You have to, as I said, you have to try really, really hard to get 0 across the board. I mean, as I said, it doesn't happen very often, so you probably haven't done as badly as you think. It is not about perfection, as I keep saying to you. It is a pass means satisfactory. So it's not about being amazing and knowing absolutely everything. It just means you're safe and you're satisfactory. The examiners might not be very smiley. I think in training, every candidate is meant to get the same experience. So we're meant to be slightly deadpan. I think that's really difficult to do. I think I have a look on my face that's like that if somebody's saying something really stupid. But we're all meant to be slightly deadpan, because if we go, yes, that's right, yeah, that you'll come out thinking you were correct, and actually it may be that you have done badly in a different question. So you'll think you've passed and you might not have done. That doesn't usually happen. I just have to say that. So if they don't smile, don't worry about it, okay? Now, you might know the examiner if some of the consultants you work with are examiners. If you have somebody you know or worked with before, that's okay. Usually we only say you have to change examiner if it's somebody you're related to or somebody who's actively doing vivering for you at the moment. And in an OSCE, that doesn't matter anyway, because actually they're asking a very specific questions to everybody. So don't worry about it. If you recognise the examiner, to be fair, if they vivaed you on a course ages ago, they won't remember probably. You will have pencil and paper in front of you. That might help you just to, draw some stuff down, to write something down if it helps calm you. Don't fiddle with the pencil if it's in front of you and you're a bit of a fiddler, but it might just help not have to stare at the examiner's faces if you want to draw something down, if you find that useful. I just want to mention briefly about the OSCE. So just double checking. Sorry. So the OSCE is 13 stations, 7 minutes each. There is, again, that not prep time, but sort of reading time in between. So it will say something outside the station. The set out of stations is on the screen there. There are no kill stations, meaning there are no stations which will deem whether you pass or fail the entire exam, okay? Some stations in some OSCEs are actually trials. They're just trying it out to see how it's going to roll. So actually might not count anyway. So please don't have a panic over it. Just again, if you have a bit of a horror on one of the questions, just move on, because again, I think we're really bad actually at working out how badly we've done. I think people come out going, oh, it was really awful, and actually get full marks. So I think genuinely we're really, really terrible at working it out. Don't underestimate the OSCE. Sometimes people have done all the practice for the SOE exam and haven't really done any OSCE practice at all. Practice looking at radiology, X-rays and ECGs. You can have a systematic approach where you go, this is a film of an adult male, blah, blah, blah. Sometimes because time might be short, they just want the obvious abnormality. And actually they may just say, just give me the barn door. Because sometimes, you know, people go through the, yes, it's, you know, well penetrated, blah, blah, blah. And actually there's a great tumour, pneumothorax or something really obvious in the middle. So usually they will tell you if it's just give me the obvious abnormality here. In the communication station, don't be afraid to break bad news if that's what the station requires. Okay, you know, that's our job, so we have to do that sometimes. Sometimes a station might finish a little bit early, a minute. It depends how much stuff there is in that station, so don't panic if it does. In the OSCE, you cannot go back though. This is the one difference to the SOE exam. The SOE you can go, oh no, I didn't mean to say that. In the OSCE you can't go back, because sometimes, you know, it might be they show you an ECG and say, what's the rhythm here? And you go, this is normal. And then they go, so in AF, and you're like, oh crikey, that was AF, wasn't it? And obviously you can't then change your mind, because they don't want what's called double jeopardy, where just because you get the first bit wrong, you don't want to affect it, you getting the second bit wrong, because all the next questions are about AF, and if you didn't recognise that in the first place, then you wouldn't get the second part. So you can't go back in an OSCE. That's the one difference. The practicalities of the exam day. Please get there early. I don't mean ridiculously, but plan your journey to have some hiccups in it, just in case. If you're coming from miles away, it might be worth coming the night before, but do not be stressed about it, because it is absolutely horrendous if you're stressed. If you have a complete disaster, which happens, it may be they can fit you in later in the week or later in that day. So there is a little bit of wiggle in that, but just don't do that, because it is so stressful that you'll just arrive in a complete heap. So just plan, just get there nice and early. I've written wear your power clothes, and what I mean by this is we all have an outfit that makes us feel good and happy in your own skin, whether that's a pair of shoes or a shirt. So put the things on that make you feel like you own the world. I know it's slightly fake because you're absolutely cacking your pants at this point, but wear your PAV clothes. Now, it is a professional exam, so please don't come in your shorts. I don't think they're saying now a suit and tie are necessarily you have to wear those at all, because actually that's not what most people wear at work. So I think just something that is respectable and smart, but something that makes you feel like you own the world. The other thing is they talk about power stances, and now actually this does have some backbone. There's some very interesting TED Talks on this, and I don't mean to say you sort of stand there as like Superman, but actually if you sit there scrunched up in a ball compared to just sort of sitting there a little bit more upright or standing upright, it will affect your performance. So it's more, and I don't mean to say you stride into the exam and sit with your legs apart, but it will just make you feel a little bit more on top of things if you do that. You're going to think I'm crazy, but honestly, go and have a look at some of the TED Talks about power stances. There is some mileage in that. Do bring some water with you. They will have water on the tables, but just bring your own water with you, and don't forget your ID. They'll want to see that at the desk just to prove you're the right person and you haven't got your mates to come sit the exam for you. Not that anybody would really want to do that, but just bring some ID. How poses. So there is, it does work. I know it sounds crazy, but it does work. The other thing just to say is, if you think you've had an absolute horror on the exam, so you come out of the Viva and you think it was horrendous, there's no point me even sitting the OSCE, I might as well just go home. We've had people, certainly for the FRCA exam, who've done that, literally do not come back for the afternoon. And we're like, where's this person gone? And they would have actually been fine. They just didn't think they were, and they were just like ran away. Please don't do that, because actually you really don't know how you have done. Genuinely, you do not know how you've done. So even if you just do the rest of the exam for practice, it's fine. You know, don't run away screaming if you think it went awfully. I remember I did that for I didn't run away for my final FRCA. I think the first part of Vivas was awful. I wanted to go and be sick because I just felt so anxious. But actually it was fine. You know, we are so bad at assessing our own performance. Genuinely, we have absolutely no idea. Other thing to say is, you may hear others talking in the next door booth when you're all doing exams, sitting in the OSCE. It can be really loud, so don't worry if you hear sort of other people talking. To be fair, most people zone out and actually don't hear it at all, but it can be quite noisy on the exam floor. So sometimes if the examiner says, sorry, can you repeat that, it might be not because you said something wrong, it might be they genuinely didn't hear, because we're all old and our ears are a bit crap. So maybe they just didn't hear what you said, especially if you're talking a bit quietly. The other thing just to say is, don't look at the books when you come out of the exam. It's never helpful. You'll only go, oh, I wish I knew it was that, I should have said that. It's not helpful. Just don't do it. You can't change what you've done. Don't look at the books when you come out. Not useful. Don't talk to other people. Just go, and there's some really nice little coffee places, go and have a little walk, but just zone out, okay? The results are several weeks after the exam, especially since the whole MRCP thing from the Royal College of Physicians. I think there's going to be a lot of care taken with exam results, and this is part of the reason we absolutely need to check that the results are proper and everyone's getting the right results. If you do fail, if for some reason that the unthinkable happens, it is not the end of the world. I think the generation of people who are probably the age of the people now who are going to be sitting the exam do not do failure very well. Unfortunately, you're part of the generation who always got a medal for turning up and don't do failure well. So some people will completely unravel because you might not have ever failed anything before in your entire life. I was a trainee support lead for cancer in Sussex Deanery, and the number of trainees who completely unraveled with an exam failure was really sad to see, actually. And it's probably because you've got other stuff going on in your life. You're trying to get on with your life. You're having children. You've got families. You've got relatives all over, and it is really stressful. But it isn't the end of the world. Yes, it's a pain in the arse. Yes, your life's been put on hold for 6 months. But in the grand scheme of life, it's 6 months, and then you will get it next time, and you'll move on. Okay. If you have had a failure, if you've had more than one failure, I do heartily recommend that you sort out doing a guidance interview. This is to come up to the faculty, to the college, and meet with one of the examiners and just discuss where you're going wrong. And this is really important, because there is no point practicing the same mistakes again and doing the same thing again, because you will get the same result. Okay, if you've had 2 failures and you don't change something, then why would you expect the result to be any different? You've got to change something. So please make sure you go for a guidance interview if you've had more than one fail. But please remember, a fail is not the end of the world. It will feel like it is. I know I failed my primary first time and I did think that the world was collapsing, but it isn't. And I remember all the things I learnt in the in-between time, and actually it will just make you a more sympathetic person for when you become a consultant and other trainees are going through this process. You will be more sympathetic. I think people who've never struggled with professional exams have no idea how other people are feeling. So I just want to say is you can do this, okay? You can do this. You are all sensible people who can make clinical decisions. We're not here to try and trick you. And and you can do this. So any questions that you want to ask, please do it via a link I'm sure that our organisers will give you if you want to ask me anything. I am very pleased to answer questions. Thank you for listening.